What is vesicular stomatitis in horses? How does it spread? And what should you do if your horse suddenly develops mouth sores or starts drooling excessively? Vesicular stomatitis, commonly abbreviated as VSV, is a contagious viral disease that can affect horses, donkeys, mules, cattle, pigs, and goats. It is most commonly recognized by the painful blisters and ulcers it can cause inside and around an animal's mouth. One of the first signs any owner may notice is excessive drooling. A horse that normally eats enthusiastically may suddenly chew slowly, drop feed, resist the bit, or refuse harder feeds. These changes can happen because blisters and ulcers make moving the tongue, chewing, and swallowing extremely painful. Lesions may appear on the horse's lips, tongue, gums, muzzles, or elsewhere inside the mouth. However, vesicular stomatitis does not affect only the mouth. Crusting and sores can also develop around the nostrils, inside the ears, on the sheath or udder, and around the coronary bands directly above the hooves. When the coronary bands are affected, the horse may become lame or reluctant to move. This means a horse with vesicular stomatitis may initially look like it has a mouth injury, a dental problem, or even a hoof problem. Not every infected horse will show every possible symptoms. Blisters may also rupture before an owner sees them, leaving behind painful raw areas that resemble scrapes or burns. So, how do horses contract vesicular stomatitis? Biting insects are believed to play a major role in spreading the virus. Known insect vectors include black flies, sandflies, and biting midges. This is one reason outbreaks are more commonly associated with warmer weather and periods of increased insect activity. A horse does not necessarily need to attend a show or come into direct contact with an infected horse to be exposed. An infected insect may carry the virus to a horse that has never left its property. However, insects are not the only concern. Vesicular stomatitis virus can also spread through direct contact with infected saliva and fluid from lesions, contaminated water buckets, feeders, bits, grooming supplies, and so on. This is why controlling vesicular stomatitis requires both insect management and traditional biosecurity. But can vesicular stomatitis be diagnosed simply by looking at the sores? No. Many conditions can cause mouth lesions in horses, including dental problems, irritating plants, foreign objects, chemicals, and physical injuries. A photograph cannot reliably determine whether a horse has vesicular stomatitis. The disease is also especially important because its lesions can resemble those caused by foot and mouth disease in susceptible livestock. Horses do not contract foot and mouth disease, but cattle, pigs, sheep, and goats do. Animal health officials must quickly determine which disease is involved when suspicious blister-like lesions appear. For this reason, vesicular stomatitis is a reportable disease in the United States. If your horse begins drooling excessively, struggles to eat, or develops unexplained blisters or ulcers, contact your veterinarian immediately. Do not load the horse into a trailer and drive to a veterinary clinic without calling first. Do not take the horse to a show, boarding facility, or another barn. Your veterinarian can contact animal health officials and arrange the appropriate examination and laboratory testing. Confirmed and presumptive positive properties may be placed under quarantine to prevent animal movement while affected horses recover. The USDA states that affected properties are generally quarantined for at least 14 days from the onset of lesions in the last affected animal. The exact requirements are determined by animal health officials. Is there a cure for vesicular stomatitis in horses? There is no specific antiviral cure, and there is no routinely available vaccine for horses in the United States. Treatment focuses on keeping the horse comfortable and preventing complications while its immune system clears the virus. Veterinary care may include pain management, anti-inflammatory medication, hydration support, and treatment of secondary bacterial infections when necessary. Horses with painful mouth lesions may need softer or soaked feed that is easier to chew, but feeding and treatment decisions should be made with the attending veterinarian. Horse owners should not apply harsh chemicals or unapproved home remedies to the lesions. Damaged tissue is already painful, and irritating substances could make the horse more uncomfortable or delay healing. Most horses recover with supportive care, although healing can take several weeks. The disease is rarely fatal in horses, but it should not be dismissed as harmless. The sores may be extremely painful, interfere with eating and drinking, and result in an entire property being quarantined. So, can people contract vesicular stomatitis from horses? Yes. Although human infections are uncommon, vesicular stomatitis is considered zoonotic, meaning it can occasionally spread from animals to people. Infected people may develop flu like symptoms, including fever, headache, fatigue, and muscle aches. Wear gloves when handling a horse's mouth, saliva, or suspicious lesions. Wash your hands thoroughly. Change contaminated clothing and avoid handling healthy horses immediately afterward. To reduce the risk of vesicular stomatitis, strengthen your fly control program and monitor every horse daily. Use fly control products according to their labels, manage manure, repair leaking waterers, and remove unnecessary standing water. Fly masks, fly sheets, and fans may also help reduce insect exposure when used appropriately. Avoid sharing buckets, bits, tack, grooming supplies, and so on. Bring your own buckets to shows, cleaning equipment before disinfecting, and isolate newly arriving horses according to a plan developed with your veterinarian. Most importantly, watch your horses eat. Excessive drooling, drop feed, difficulty chewing, mouth ulcers, unexplained crusting, and sudden lameness associated with coronary band lesions should never be ignored. And remember, we are not veterinarians, and this narration is intended for general education. If your horse shows possible symptoms of vesicular stomatitis, contact your veterinarian and follow the instructions provided by state animal health officials. Vesicular stomatitis may begin with something as easy to overlook as a little extra saliva. Recognizing that early warning and avoiding unnecessarily movement could help protect every horse in your barn. Thank you so much for joining us. And remember, I am not AI. If you listen closely, you can hear me breathing.